So, Dr. Patel, for this next question, I'm going to preface it by saying that anybody that I have ever talked to in my advocacy work about myeloma and how to get care for myeloma, I'm a huge advocate for seeing a myeloma specialist. And I will tell everybody out there that Dr. Patel at MD Anderson is my myeloma specialist, and I've been with her since I was diagnosed in 2018. I live in an area where we don't have any myeloma specialists, and so I'm an advocate for that. And anybody listening, I hope that they know that they can seek out the care of a specialist, even for initial consult or even once throughout their journey. Having said all that, I know Dr. Patel, because you've talked to me about them before, that you're involved in some clinical trials for CAR T therapy. Can you talk a little bit about your trials that you're doing right now that offer CAR T in earlier lines of therapy, including frontline therapy, and what this could mean for patients?
Yeah, no, I think the CAR T trials are what allowed us to even get to second and third line, right? The Karma 3 and CARTITUDE 4 were the two trials that brought ide-cel and cilta-cel up forward, which was fantastic. And I think, now it's how can we improve even further? So some of our clinical trials are even earlier line, like you said, frontline. So we have one called Karma 9 that is for patients who have less than a VGPR, meaning that they didn't get all their myeloma gone after their initial transplant. If they went to transplant, you can do consolidation with CAR T. And we've had a few patients that we did on a smaller study called Karma 2 they're doing really well after they were on that cohort for that study. So that's sort of why they're doing a bigger study for FDA approval now. And then CARTITUDE 5 and 6, we don't have that at MD Anderson, but a lot of centers do. But that is now trying to see if cilta-cel can actually beat stem cell transplant, which again, a lot of us are really excited about. But we need to do the trial to make sure it's just as safe and hopefully, more efficacious, right? So I think those are really, really important. Auto transplant, I was a transplanter when I first became faculty at MD Anderson. And so, I do think it has a role, but it's high dose chemo. And, there are secondary potential, side effects that can happen. And people really have to kind of stop their lives for, at least 2-3 months, if not longer, to go through that. Where in CAR T, I think it's that quality of life piece. Again, it's one and done. It doesn't take as long to recover for the majority of patients. And it really is using immune therapy instead of chemo to kill that myeloma, right? So it is very different. And we've seen some amazing depth of response for CAR T compared to what we see with normal chemotherapy. So the other piece is how we have other trials that are doing earlier lines. So there's new CAR Ts that are coming out, hopefully in the near future as a standard of care. So there's one called dd-BCMA. It's a study by Arcellx. And the big news was that Kite, which is one of the big lymphoma CAR T companies, just took over to do their big phase 3 study. So hopefully we'll have FDA approval for this in the next year with our phase 2 study. But the phase 3 will be in second, line forward, just like the CARTITUDE 4 was. And this CAR T, it's different in the way it's built. And we really don't see any of the neurotoxicity at all so far, which has been pretty impressive. But we see the same efficacy that we saw with cilta-cel. So this could be sort of best of both worlds, knock on wood. But so far, we've seen some really great responses. And I think that trial being offered earlier will be great as well for a lot of our patients to get something that might be better than what we have already. The other trials are with other targets. So we do have some studies that are looking at different targets instead of BCMA. So now we have patients who have already had CAR T with BCMA, and over time, years for the most part, they're relapsing. And so now we have GPRC5D CAR Ts that are actually being combined with different things to then be able to give them a little bit earlier rather than waiting till after BCMA or fifth line, et cetera. So we have lots of trials looking at all different ways to combine CAR Ts or newer versions of the BCMA CAR Ts that I think are really, really exciting. And I think it's really hard to keep up with this. So my activation tip here is, really talking to a myeloma specialist about different options that are out there for trials, because different centers will have different trials that are open, and you need someone to help you navigate with that, which ones are the best ones for you. And then I would say talking to your patient advocacy groups, because that's really where a lot of my patients hear the information. And then they come to me and say, listen, I heard this, what does it mean? And I think that really helps you, kind of even know where to start from.